Hello, everyone. This is Dr. Mary Lauder, and you are listening to the Since You Put It That Way podcast. It's the show that examines various health, wellness, and medical topics from unique perspectives. We will be having discussions and guests that will cause you to pause and consider, well, since you put it that way. Hi, Dr. Mary Lauder here. Welcome to our episode of Since You Put It That Way. Today, we're going to be in conversation with Dr. Ramona Wallace, who is an osteopath like I am, and we trained at the same medical school, Michigan State University, and she's going to be bringing to us her information and exciting research that she's doing regarding micronutrients, adverse childhood experiences, and actually finding scurvy in our community, if you can imagine that. So I guess I didn't know we had a bunch of pirates here, right? So scurvy is vitamin C deficiency. And so we're going to be talking about the influences of nutrition on our health from a micronutrients, which is going to be vitamins and minerals. So stay tuned for this episode of Since You Put It That Way. And it's a very, very interesting conversation. Great. Well, welcome everyone to our conversation with Dr. Ramona Wallace, who is a fellow, or should I say sister, osteopath here in Michigan. And some of our paths paralleled, but not exactly crossed until recently as colleagues. So welcome to Since You Put It That Way.
Thank you. Thanks for inviting me, and I appreciate you taking the time to do this.
You're very welcome. We've got a really fun topic today. It's an important topic about understanding nutrition, adverse childhood experiences, and really looking at a component of nutrition called micronutrition. Now, for our listeners, what micronutrition is, it's the vitamins, vitamin C, vitamin A, vitamin D, minerals, zinc, things like that that make the cells go round. Macronutrition is going to be carbohydrates, fiber, fats, proteins, things like that. And so the body requires both of those things to work well, and both of those things to have adequate components for a healthy functioning of our biochemistry, our physiology, our anatomy, our immune system, everything. So basically, it's the components of what makes our world go around as humans, right? In a large part. So Dr. Wallace, share with us, I'm going to call you Ramona. You okay with that?
Absolutely. Go right ahead.
Wonderful. Share with us your background as a physician and what drew you into this particular topic of micronutrients and nutrition and things like that.
Okay, super. Well, thanks. That's actually a really good segue. When I was in high school applying for what am I going to do with the rest of my life, my mom's a nurse anesthetist, so of course, naturally, it was either nursing or medical school. And I really loved physiology in high school. Really enjoyed physiology at MSU. Dr. Stevenson, I still remember him, and that was a long time ago. He was fantastic, and he made physiology make sense. So medical school, it really made sense. Then I'm looking at osteopathic versus allopathic. And surgery, yeah, that was interesting, but the osteopathic approach really resonated with me because it looked at really N equals 1. It looked at the person you're dealing with right in front of you, using evidence-based, of course. And really the approach was, here's the person, what's their story? And of course, my entrance into medical school was, why do you want to go to medical school? Well, I love physiology and I love helping people, and I really enjoy helping people understand and put the pieces of the puzzle together. So through this journey and being in private practice for a long time, about 17 years into practice, a friend of mine called up and said, hey, what you're doing with childhood obesity, with childhood asthma, allergies, we really need you in this public health sector in Muskegon to work at a federally qualified health center. And I thought, wonderful, because what I'm seeing is not being promoted in the literature. It was this pharmaceutical, that pharmaceutical, and I'm thinking, okay, there's a disconnect here. And when I got to Muskegon, it was kind of interesting. They put me in charge of the childhood obesity work group.
Mhm.
And I said, well, the first order of business is that we need to change the name of this work group. And they said, we really don't have a problem with childhood obesity here in Muskegon. And I thought, really? I don't know what you guys are thinking, but that made me realize, I said, show me your statistics and your data, because Muskegon was of particular interest of mine to work in, because it was 82 among 82 of all counties in the county health ranking in healthy behaviors and health outcomes. So a lot of these things didn't make a lot of sense about statistics and reporting and stuff. And come to find out, what the disconnect was is that we weren't talking about growth charts and percentiles with children. We were saying a BMI of 30 in a child is obese. If you wait till a kid is obese with a BMI of 30, we've got problems. So then I started to connect the dots and say, I think we are lacking data and we are really getting misinformed. So I started digging deeper. Allergy, immunology, working with some of the companies that did allergy testing, and really putting pieces together, and having the opportunity to work with Esther Dyson and the Way to Wellville. Then she brought in the adverse childhood experiences, realizing that communities that have significant trauma, that have big divides as far as the haves and the have-nots, and that's what Muskegon is. You have a lake shore and then you have an inner city, and never the twain shall meet. And it was really interesting because they were trying very hard to help the health and wellness of the community, but it wasn't until Esther Dyson she put together this Way to Wellville, brought in some very important people who helped dispel the myths, who helped merge the information and bring out the accurate data. Then I learned about functional medicine, and the Institute of Functional Medicine was an add-on to my allopathic and osteopathic training to really explore on an evidence-based level to put together the N equals 1 and use the statistics and use this aggregate of data to really apply it to what is important to you as an individual and how you've experienced things. And then a whole new world opened up for me to understand, what are the person's, what is their life experience and how did it impact them? So you were earlier talking about, and last night talking about, inflammation. What is inflammation and what does it mean to you? And you made a really good point with long COVID and fatigue. Why do some people have it and why don't other people have it? And it's really our genetics, right? Our epigenetics, our metabolomics, and then what happened from point A to point B to get us there. So I started to say, okay, I want to put this down on paper, and the best way to, in my mind, to do it was to get connected with a university and start publishing. So it's taken me 5 years to convince the university to say, hey, the population that's struggling the most are the population that had these micronutrient deficiencies. And they're like, we don't have micronutrient deficiencies. I said, we have scurvy. We have vitamin A deficiency.
We have scurvy, vitamin C.
We have scurvy.
I
And
thought
that was their
pirates on the ships.
yes. And that is the response. And they said, okay, prove it. So I
Well,
do.
that was,
And
I'm
I
sure
said,
that was a
okay,
great,
I'll prove it.
that was a great challenge for you, right? Great.
Oh, it was perfect. I said, I'll prove it. So about 2 years later, mind you, I see about 100, or I work 2 half days a week seeing patients. A lot of them are repeats and stuff like that. And I work in the hospital about 5 days a week every month. So I don't have, it's not like 100 patients a week, right? I was able to document and describe 171 people with scurvy,
Just with that small population you have.
tiny population. But I knew what to look for. You know why?
Why?
I looked in the Merck manual. Remember the old Merck manual?
So for our listeners, the Merck manual is a manual that describes physical exam characteristics, how to complete physical exams, as well as diagnostic approaches to the patient long before we had imaging, high tech, and no touch. It was all touch back then, and listening to the patient, taking their history, understanding what was at that time the known pathophysiology, right? Which means pathology of disease and what's happening in the process of the body, and how and what you would see on the patient for a sign, which is different than the symptom. Symptom is what the patient experiences, the sign is what you find on the body objectively, right?
Very, very well put. You just wrapped it up in a beautiful package. And which brings me to the point of why that was so significant. Why, when I pulled out the Merck manual, scurvy is in pirates. James Lynn described it a long
Arg.
time ago.
I'm just gonna do one for the pirates. Arg.
Our meeting. And so it wasn't that hard to okay, you go in the dental literature, it is flooded with information about in 1 month of low vitamin C, you get periodontal ligament weakening. You talk to a dentist about vitamin C deficiency, they're all over it, right?
Yeah.
And in kids, and then you start talking about smoking. We know smoking. I don't have to prove any of that. Smoking interferes with the vitamin C and
Mhm.
its ability to be metabolized or synthesized. It's an antioxidant, vitamin C.
Yes, it is.
Smoking causes oxidative stress.
Yeah.
Then you dive into the literature. I don't have to prove anything because it's been proven, written. The only thing that I have to prove to my peers is that we've lost the critical thinking pathway that the Merck manual gave to us a long time ago about the pathophysiology of disease,
Yeah.
right?
Yeah.
And
So that's super interesting, on so many levels. And I'm like going, okay, where? Oh my gosh, we have only so much time, but I think this is great. This is great because if I think of that, what we've lost and that's right in front of us, because I want to go back to what myths you found. But first, I want to say what we've lost with all of our high tech is just our ability to go back to the basics. And
absolutely.
medicine, what happens is we get trained now to understand anatomy, physiology, and then treatment. But the treatment is just told to us what the treatment algorithms are. You try
Correct.
this, and then if that doesn't work, you go to that drug. If that doesn't work, you go to that imaging. If that doesn't work, you go to that test, and then you go to that drug, then you go to that specialist. And there isn't anything in there that is critical thinking because it's
Right.
all algorithm driven.
Correct.
And it's not going back. So Sir William Osler, who is the father
Mhm.
of modern medicine, said, listen to the patient because they will tell you what's wrong with them. That has
Oh,
never failed me. I actually have that above my desk here in my home office. That has never failed me. And then I put a caveat on that of when in doubt, go back and re-examine the patient and take the history again.
mhm.
And that has never failed me in 30 years. That has never failed me. That's not high imaging. That's not going and doing more testing. It's like, what am I not understanding in the patient's story that's right there?
So what you said is exactly which led me to um, what I've learned with teaching residents and medical students. Who's easier to get to see this process, do you think, when I'm trying to teach?
I'm going to I don't know.
It's so I'm sure my medical students are little sponges. And
Okay.
they're right next to their 1 hour of nutrition education
Yes.
because they are aware that vitamin C is an issue. They're
Okay.
like little golems. So they are not corrupted thought wise. And
Like the residents would be already.
exactly.
Really just a matter of 2 or 3 years away in
Yes,
the distance. That's not far.
that isn't far. My medical students pick it up like that. And it's amazing because so many of them come back and say, you can't unsee what you've shown me. And now that I see it, and I can't convince anybody else. And when I make them draw a vitamin C and they get a low level, they say, oh, that's a one-off. But they're right. It's not a one-off.
No,
It's not a one-off.
no.
And
Because that's interesting that they say it's a one-off, because in residency, it was always the joke about who has porphyria, which is this weird blood disease. Sorry if anyone has porphyria, and I'm not trying to dismay you at all, but I'm just saying it was always the red herring. It was always the weird thing. It was always the unknown. Don't forget the unknown. Well, if you hear hoofbeats, it's going to be a horse, not a zebra, because there are more horses than zebras, right? And that's another thing that we learned in medical school. Common things occur commonly. But one of the myths that I would dare say, that you learned from the community you were in, was that basically denial. This just doesn't happen anymore because we aren't pirates on a ship and we are in a modern world. So this just can't happen anymore.
And if you look in the literature, every time I look at a case study, a, a rare disease, long ago, not common, all these phrases about scurvy. If I can go and find 171 people with scurvy in a short period of time in a small select group of patients, it's not that hard. I mean, it really isn't. And I'll tell you what they are. If the person, number one, does not eat sufficient amounts of fresh fruits and vegetables,
Mhm.
right? They're not taking supplements. They're not doing anything. They're depleted on their intake for at least a month, because it takes 1 month to deplete your body's stores of vitamin C. We
Okay.
don't synthesize it. We need to consume it. So that's why I really like vitamin C, because it demonstrates this beautifully. So that's number one. Number two, usually are smokers or they're exposed to secondhand smoke, whether it be an adult or a child, right? So that depletes your vitamin C, because if you're a man, you need 75 to 85 milligrams a day. And if you're a woman, you need about 95. But if you're a smoker, you need 135 to 40 milligrams of vitamin C a day, right? If you're not getting it and you're smoking, you need higher amounts and you're not eating it. Then I look for the physical signs: fatigue, periodontal ligament loosening, and dental loss or dental caries. And then I look for chronic pain, 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 pain. Um, Jeffrey Lind or James Lind, they described it 300 years ago. The joints ache, they get bleeding and bruising. And it's interesting. I've even had my patients say, yeah, when the orthopod got into my knee to do the replacement, they said it was all black. That's scurvy,
Oh, fascinating.
isn't it?
And I've been on the inside of a number of knees, and I never saw it. Number one, interesting now that I know what it would have looked like. I never saw that, but fascinating that it's right there.
It's right there. Mhm.
Also super interesting about this myth of it doesn't exist anymore is we don't because it's the modern world and we use so many pharmaceuticals, we don't have a disease, a disorder, or signs and symptoms because we lack a pharmaceutical.
Oh, good point.
I mean, it's not, it's because there's something within the physiology that's gone awry, whether it's excessive inflammation that influences the psychoneuroimmune system, endocrine system, whether it's a vector meaning an infection or chronic stress in some level. And so, and emotions, how they play in. And none of those are there because we lack a pharmaceutical.
Isn't that?
It has its influence within our environment, our genetic exposure, our predispositions, and then our basis of nutrition and those components as the building blocks.
They're basic components. And so it's interesting because working at a federally qualified health center, here's the adverse childhood experiences, right?
Yes. Yeah, do you want me to let me list those for our listeners, just
Absolutely.
they don't, and I wrote them down because I wanted to make sure I had all of them. So adverse childhood experiences are those things that occur in early childhood that affect, and we know have increased effect on chronic illness in youngsters, teenagers, adults, well into our old age. So they are in no particular rank order. If a person experiences domestic violence within the home, a parent abandonment through either separation or divorce, a parent with mental health issues, being a victim of abuse, whether it's physical, sexual, and or emotional abuse, being a victim of neglect, a member of the household is in prison, and then a substance use disorder within the house. So that could be alcoholism, that could be drugs, that type of thing. So, and the research there is what's fascinating, just super quick caveat. I spoke at a medical school in the fall. Well, it was our alma mater, and I talked about ACEs. They went blank.
It is probably the largest public health study done. Vanetti and oh gosh, Andy and Vanetti. It's very, but it was done on 18,000 people. Kaiser Permanente did the study.
Yes.
Huge study, great evidence base. Amazing job, and it's probably one of the most important public health studies that we did. It's interesting because the adoption of that is very slow, but it's so significant and impactful. From a micronutrient level, you take a child who experiences trauma, right? Fight or flight. We all experience trauma. We can't fix any of it, right? But think of it from a micronutrient level. Kids are picky. They don't eat a lot of green vegetables. They don't like nuts. They don't, they like carbs and starches, which is where we're at. Then you take somebody with a genetic single nucleotide polymorphism, and you take the methyl tetrahydrofolic acid reductase enzyme, the MTHFR, where you can't methylate folic acid, and you don't have the intake as a kid with ACE scores, trauma. What happens to their brain, and what happens to the metabolic memory?
Okay, that was, I thought you were asking me a question. Anxiety and ADHD is what happens to that child. It's right.
Bingo.
Yeah.
Bingo, exactly. Now you throw on parents who smoke in the home, their vitamin C is low because they don't like their fruits and vegetables. They're tired, they're not focused.
Yes.
They have an MTHFR, they can't metabolize, or they can't methylate, they can't make an ATP. Their whole system is now wiring, but they have the resiliency because they're a child until they crash and burn at 30 or 40, because you have kids, you have the allostatic load of motherhood or the stress of fatherhood and all this that goes into it. And we dismiss these micronutrients, and we dismiss what a metabolic memory is in our system and how we're neuroprogramming, right? This gets into really deep science, but to me, it's fascinating. And looking at people with these variants like the MET variant of the catecholamine methyltransferase.
Yes.
Simple, real simple, but means you can't break down the catecholamines at the same rate, the norepinephrine, the epinephrine. So
Yes.
you get frightened and you have an inability to break down these stress, fight or flight genes, and it goes on for days. And
Yes.
then it takes 12 hours for us to relax after one traumatic event. Who goes 12 hours without being stressed, right? So we get into the stress cycle, and blood pressure goes up, heart rate goes up, sugar, insulin response goes up, all the stress response. And if we're chronically in this and we have a genetic inability to break these fight or flight defenses down, how do we sleep? By the time we're 30, we're not sleeping. By the time we're 40, we're not sleeping. And it begins very early on. And micronutrients and our ability to metabolize them starts in utero. We give mothers folic acid. Why do we give them folic acid? Right?
Yeah.
We check their iron. Are we
Exactly.
checking their C, their B6? No, we're not looking at any of it. We're throwing at them vitamins, but
Right.
we're not helping them understand food, nutrition, and how their body works and who they are as a person to understand how to mitigate some of this. All basic premise of functional medicine, right?
Right. So what's interesting when you talk about the folate in mothers and things like that, and why moms get on pregnant moms get on multivitamins and prenatal vitamins. What's the one thing that comes up? And only spina bifida, right?
Mhm.
Which
That's
is,
it.
yeah, which is the end result of really a bad, inability to methylate. But that's into the skeletal system, and spina bifida is where the spinal bones, the structures of the spine, the bones don't fully form and leave the spinal cord exposed. And so there's instability, and that stays with a person their entire life. But that's the only reason we talk about folic acid, right? And
Yes.
but really we're looking at setting neural pathways first in embryologic development, aren't we?
Let's
And
talk about autism,
yes,
ADD,
yes,
PTSD, right? We can jump right into all those neurologic and the connection. And why don't we talk about MTHFR? No pharmaceutical company is going to support broccoli.
right. So
Okay.
MTHFR is one of the main genes, which they do not operate alone. That's my thing. That is a thing. I have it on the wall. Polygenomic, multiple genes influence our health. Not just one gene makes unless it's of course, something that's a mutation or an insertion or like a trisomy 19 and things like that. We're talking that there's influences upon the genes, but it takes a group of those genes who have an overriding influence together and how they work in concert. And what Dr. Wallace, what Ramona is saying is because the vitamin C is a key component in so many steps in the methylation pathway, which, by the way, influences 300 pathways in our body at minimum,
Mhm.
that this is an underpinning. So this micronutrient becomes literally a major player.
Folic acid, B12, thiamine,
Mhm.
and we can't produce energy.
And selenium fits in
And
there too.
selenium.
A lot of
And
folks.
selenium. I can't tell you the number of people who come in. I feel like my thyroid is a problem. I've looked it up. I have all the symptoms, but my TSH is normal. We've heard that story a million times. And I say, look at your B6 and look at your selenium level. And lo and behold, they're both low. People, my residents, oh, that's a one-off. You got lucky. Okay,
Oh,
I must be a very lucky person,
exactly.
Mary.
Like I'm taking you to buy a lottery ticket right after we're done then, because you're my guest. Well,
Absolutely.
it's like we'll be able to fund whatever research we want, right?
Absolutely.
It'll be great.
And getting into this micronutrients, it starts with the kids. It's
Yes.
easier to prove in adults because, insurances do cover if you have micronutrient deficiencies, and if you have symptoms, it's covered. Kids, parents don't want to bring their kids in. There's so much stigma behind, if,
Yeah.
I don't want you to do blood work on my kid. I don't, it's holy
Right.
cow, we're missing so many kids we could help.
So we've got this paradigm of the ACEs, adverse childhood experiences, being in the public health domain.
Mhm.
So, in your research that you're doing, and I think you mentioned you're waiting for a new set of data to come through. And
Yes.
and I think this is something that I think down the road we need to come back to our listeners about, because you and I have a few meetings on the books with some folks within our state of Michigan regarding this topic and how to influence from a public health standpoint some outcomes just based upon the data that already exists, which is really quite exciting. And I'll say that I shared this with my local state representative, and her eyes just popped that how easy, number one, the fix was. So
Mhm.
certainly with adverse childhood experiences, you want to go upstream, right? To deal
Right.
with those things.
Mhm.
Those are generational things, right?
Those
And they
are
take time and influence. The quick fix is to give a vitamin C tablet, right?
right.
And to give a multivitamin if needed. So, and that's not to downplay anything, but that is to fix what we have in front of us and then begin to influence the reasons why.
Right. And to recognize, right? We have to recognize and validate that this is the problem. And when people say, I have depression, I have fatigue, those are labels that have been developed so that we can design a nice screener so that we can put you, oh, you meet all the required criteria for this pharmaceutical. So we're learning to screen for the right pharmaceutical, but we've lost what you and I have been taught, and that's basic physiology and diagnosis in the individual. And to me, looking at these patterns of who they are, and it's not why you're this way, but it's what happened to you along the way. That pattern has been lost, right?
Right. That's
Because it's a 15-minute office visit.
right. But to be
Right.
sure, you and I have thought this way because that's how we're wired.
It is. Good point.
So we're storytellers.
Hmm.
And we look at the person in front of us as, a set of data with a soul.
Yeah.
And so to be sure, that is where in medicine healing can be infused. That's where connection can be infused. That's where the humanitarian aspect of medicine that goes just beyond the clinical recognition of a diagnosis. I mean, diagnosis is great for hierarchy and billing and organization, but that's not what the person is. That's just how we've categorized them.
Oh, I like that. I'm
Yeah,
glad you recorded that because that goes in a book.
yeah,
Yeah, we need to
yeah.
infuse that healing. And I really like what you just said.
Thank you. I am writing a book. Stay tuned, everybody. It's coming out in the middle of 2024.
Ah,
So
put me on your list.
yeah, I'm in the final stages of writing, which is kind of fun. So okay, so then we've gotten really through looking at, and I want to circle back about that myth. So, we have the myth that it doesn't exist or that you need to be a pirate to have it. That's a fun myth. I'm going to stick with that one because that's a fun story. But do you think can you think of, another one or two myths that emerged in your understanding when you looked at micronutrients, or is it we're just being, you know, um, not aware anymore as physicians, or to think that that's oversimplification?
Oh, absolutely. It's more a bias than it is a myth, I think.
Excellent.
And that is people won't change. And oh my goodness, the population that I get to work with, the underserved, the marginalized, absolutely embrace these changes.
Yeah.
As long as I explain to them, they have the capacity, and the competency. They may not have the access to food. They may not have had the education to the food, what you need to do eating. I get more adoption
Yes.
of lifestyle changes in the population that I'm currently working with, because family is priority. And
Yes.
when they start saying, oh, this is why I don't feel well, this is why my son doesn't feel well, my daughter, my mother, family is super important.
Yeah.
So it becomes a whole unit that they change, and everybody starts feeling better and the connectivity increases. So that bias or that myth that people won't change is not true at all. It's
Yeah.
almost, and people, the other big myth that I get that just blows my residents' minds, they won't give up their substance use, whether it be meth or cocaine, or they won't change. Not true at all. You get people feeling better because they can't imagine without the alcohol, without the drugs, that they'd actually feel better,
Right.
right? But
And they're self-medicating often because
when
they,
I identify and validate that they have scurvy or they have another micronutrient deficiency, and I replenish it and get them to eat better, you know what? They feel better. They say, I could have my life back because they actually feel better. So those are huge myths.
that actually
And
just
everybody changes when you feel better, because that's why we pick up those maladaptive behaviors, right?
is exactly.
That's
So
what we
that
learn to
just,
cope.
that just told I had goosebumps. Okay. So if we look at this, the ACEs, trauma that occurs to us is what happens in our body. The traumatic event is what happens to us. We don't have control over that event. We have control, and we don't really have control what happens initially in our body. It's how we process that. But that all that trauma causes us to dissociate
Yes,
every single time.
beautiful.
And so what happens is that dissociation has this tether, a cord, that we're connected somewhere to ourself. When I say self, I mean our soul. First, who we are, what our purpose is being here on this planet, our soul. And so that tether becomes long or short based upon how close we are connected to ourselves. And everything on that tether becomes the maladaptive behaviors that keeps us tethered. And that could go all the way to the point of addiction, or that could just be dysfunctional behavior or whatever, whatever. The goal of trauma informed therapy and treatment is to restore that individual back to themselves through self compassion and awareness and understanding and reconnection. If you're connected to yourself, you can then connect with others. We're hardwired for love, belonging, and connection. If we don't have that, and we're unable to connect with others, it's largely because we've never fully reconnected or connected to ourselves first. And so,
And
yeah,
what you just said is so foundational. And I hope you do put that in your book, because what does it mean connecting to yourself? There's a big, right? That's a
that's our
journey.
life's journey, really, is
That's a
connecting.
journey. But when you're so disrupted inside and you can't relax because your whole metabolism is either not being nourished,
Right.
meaning you don't have enough vitamin C, you're tired, you're not producing ATP, the unit of energy, you're not able to break down your catecholamines, your epinephrine, norepinephrine are running hog wild in your system, you feel anxious, hypertensive, all this, you name it. How can you connect? So
Yeah.
it's really restoring the foundation of the micronutrients that you said in the beginning, not overindulging in the macronutrients, but really looking at the micronutrients that are basic building blocks and restoring that foundation in order to be able to make your prefrontal cortex function. You get rid of the brain fog when you're in your 40s and 50s, because you're understanding how vitamin D plays a role. You're able to de-stress because you're now methylating. You understand that you have this genetic variant. Your autistic child, wouldn't that be wonderful to help
Yes.
them function and neurotransmit properly?
Anxiety is off the chart right now with all young people, 100%. And we're blaming the pandemic, but I don't know that it's the pandemic. I think it's micronutrients
It
maybe
is.
and true pandemic. I can't say that, but I'm saying, kind of
Right.
tongue in cheek. Maybe that's one of the, one of the true things coming through. Um,
We've got a lot of work to do.
we do. And so, okay, a couple takeaways for our listeners. One, get your micronutrient levels tested. What? Vitamin C, vitamin D, zinc, selenium. What else do you recommend? The
If you
B.
consume alcohol, thiamine, B12, the standard blood testing, it tells your current micronutrient. So it's like a blood sugar. It's a shot in the place and time, and they're water soluble.
Right.
So the problem with testing it is if you've been on supplements, don't test it. It's going to be normal. It's going to be absolutely normal. A lot of the tests like urine and metabolites, and those don't have the big studies behind it. The reason I'm able to capture this is because I'm looking at a true population that do not have access to food, typically don't eat. They're coming in fasting because they haven't eaten for days. Their nutrient patterns or their eating patterns are really reflective of chronicity.
Yeah.
So if you have night blindness, poor night vision, you've had your gallbladder out, and you do consume some alcohol, or you have some liver related disease and you have night blindness, get your vitamin A tested. No questions whatsoever. If you have bleeding problems, certainly get your vitamin K looked at. If you are a smoker, you don't take supplements, you don't eat fruits and vegetables, your teeth are having some problems, do a vitamin C level.
Yeah.
If you have mood issues, and gut issues, B6, thyroid issues, B6 and selenium. These are repeated patterns that I'm putting the evidence behind so that they can actually bubble up to the surface of medical school to teach our providers to say, oh yeah, this could be a problem. If your provider gives you pushback, bring the evidence in. But if you're taking a supplement, all bets are off.
Yeah.
Labs are going to be normal.
Yeah.
That's the big key takeaway.
Yeah. Okay. All right. Excellent. So, well, thank you very much for this engaging, enlightening, and important conversation. I really appreciate it. And I'm just going to invite you back when you have more data. So there.
Thanks for giving me a platform to talk about this stuff so that hopefully people can get out there and spread the word and help our kids and help our communities be healthier. So thank you for everything that you're doing to give us all a voice of some of the things that aren't really flashy, right?
Absolutely.
So thank you. I really appreciate the time, and talk to you soon.
Yes. And speaking for all the pirates, ARG, thank you for being here. Thank you for joining us on the Since You Put It That Way podcast. Today's episode was written and produced by Crowded Table Productions. Technical editing, Malin Long Lopes. Sound editing, Jonathan Fiegel. Music, The River Jordan, written and performed by May Erlewine. Please rate and review our podcast as well. We appreciate your feedback, and hey, be positive, share the love.